and Ecology Policy and Accountability Committee. Before we begin, there are some housekeeping points to cover. The meeting is being live streamed on YouTube. By taking part, you are consenting to be recorded. Please can officers introduce themselves before speaking for the first time? And would you please use your microphone in front of you? It is the little person button and it goes green. There are tea, coffee and biscuits available in the staff kitchen if anyone would like anything. And the toilets are on my left-hand side through there. You might need an H&F staff member to get you into the kitchen, but actually the door's open, so actually you can just help yourself. If the fire alarm sounds either continuously or intermittently, I will adjourn the meeting. Please leave the meeting in an orderly fashion by the staff fire exit, which is behind me to my right. Officers will direct you to the assembly point in Riverside Gardens. Let's proceed to the agenda. Apologies for absence. We have apologies, unfortunately, from Councillor Campbell-Simon and Councillor Miri. But we do have with us, we have to welcome two new committee members, Councillor Lloyd Harris and Councillor Nimmo. Thank you for participating. We should also just take a minute to say thank you to outgoing committee members for all their work, hard work and contributions over the last couple of years. And they are Councillor James, Councillor Antonades and Councillor Afonso. So on to declarations of interest. Do we have any declarations of interest? Very good. None. To record minutes. The members agree the minutes of the meeting held on the 7th of May. Yes.
There are a couple of points regarding the questions were asked of James Taylor, and there was no.
Sorry, could you put your mic on just because it's
apologies?
They won't be able to hear at home.
Okay. There were two questions that were asked, and there was no sort of follow-up when they were asking about specific information regarding Hammersmith and Fulham. And I was just wondering, do we ordinarily ask people to follow that up and provide you as a chair with the information?
Yes, so I believe those answers were forwarded by officers. Do one of you want to pick that up? Because it was sent directly out to the person who asked the questions. Is there a procedure point here? Should they be circulated, those answers?
Is it an action? Or if it's an action, then officers usually send them out either to myself or to the committee directly, but it depends what.
Hi, I'm Hinesh Mehta. I'm the Assistant Director for Climate Change and Transport at the Council. We have responded directly to the questions that were asked. A set of questions were sent in advance of the last committee meeting from a group of residents, and we responded directly to them.
And we can make those available to you.
We can, yes. If I...
Yeah, so could we take that as an action? Thanks very much. Very good. Any more questions about the minutes of that previous meeting? Minutes agreed. Thank you. I'd just like to take a moment before going on to tonight's agenda to congratulate the team at Hammersmith and Fulham for the Climate Emergency UK's Action Scorecard for 2025 has ranked Hammersmith and Fulham as second best in the country and only 1 point behind the very best. So I think congratulations need to go out. The council improved its score in every assessed category. I think we need to send our thanks to the climate champions, the Volunteer Climate and Ecological Emergency Commission, council officers, and all the residents as well who have done their bit to improve our local environment and tackle the climate and ecology emergency. A great achievement. Well done. And I think we should also note the amazing work done by the team here in Hammersmith and Fulham for London Climate Action Week. It brought so many events and initiatives to the forefront. Thank you for that work. Really well done. Now, I don't think we could have picked a more appropriate topic for this evening's meeting. I think weather events. like the last few days, really concentrate the mind. Air pollution is a critical health issue, and we've asked for a report on how we are rising to the challenge of tackling that. So we'll go first off to the council officers, to Adam Webber, if you'd like to take over.
Yes, thank you very much, Chair. I'm Adam Webber. I sit in the Climate and Transport team in the Place Department, and I'm the Council's Air Quality and Active Travel Lead. Been at the Council for about 18 months, did similar work on air quality previously at Westminster, and before that at Camden Councils. So I'm going to rattle through the first of these sections quite quickly, but a bit of kind of pollution in context. I won't touch too much on the health impacts because we have Dr. Gareth Thompson here from one of our NHS trusts who talked a bit about that, but really want to focus on kind of the principles and plan that we have, our air quality action plan, and then also kind of some of the key opportunities and challenge for our kind of priority work areas, and some of the actual tangible, some of the sort of tangible projects that we're doing at the moment. So just very briefly, because it's often kind of unsure what the sort of baseline level of knowledge is sometimes around kind of this kind of thing, but what air pollution is a kind of a combination of, or a variety of different pollutants, gases, compounds that have an adverse impact on human health. What it isn't, it's not classic greenhouse gases. It's not carbon emissions. They're often the same, two sides of the same coin. And you know, as I go through the presentation, you'll see the synergies are really strong and the co-benefits are really strong between our work on air quality on the one hand and the council's wider climate emergency work. But there is a, you know, there is a distinction to be made there. So in terms of the health impacts of pollution, I won't go into this in much detail, but they are increasingly well understood, but also being built on all the time in terms of actual research. Pollution adversely affects people's health throughout their lives. And the effects are both related to kind of the short-term impacts of short-term high exposure, but also the kind of longer-term impacts of high pollution. As I say, pollution affects all of us, but it does have a disproportionate effect on the young, the old, those with pre-existing health conditions. And actually, you can view pollution as a really key inequalities issue for the council, because it also has lots of implications in terms of exposure related to social mobility, deprivation, ethnicity, and the like. So it's quite hard to see from these screens probably, but the graph on the left here just shows, this is for London wide. If you were to split London into 10 groups of sort of geographies of lowest pollution on the left to the highest, the yellow bar is for the sort of, if your ethnicity is white. So you can see that if you are white and you live in London, the sort of the decile that you're most likely to live in with pollution is where pollution is the lowest. And this kind of inequalities issue is something that we've just started mapping really in the council, and thinking about how we can overlay pollution on top of other environmental factors like heat risk, flood risk, and others. So that's one of the maps there on the right. What's the data telling us in terms of where pollution comes from in the borough? This is model data of the sources of pollution for nitrogen dioxide, which is a noxious gas and one of the key pollutants. I won't talk through all of the numbers on this, but I would just draw people's attention really to the sort of the lilac bar, which is road transport emissions and how they are kind of reducing as we move forward, and the sort of darker blue bar, which is commercial heat and power. So essentially emissions from commercial buildings, which, as you can see, stay relatively stubbornly the same throughout from the 2013 to 2030 modelling period of this data. So relatively, transport emissions have reduced a lot, and relatively building emissions have kind of stayed the same. That obviously has implications in terms of kind of our policies, our priorities, and the kind of the work we want to be doing. Looking at particulate matter, which is a combination of different sources, but fine dust particles. Again, the largest of these, the largest source we've got here is from construction in the borough. So slightly different. So depending on the type of pollutants we're talking about, the sources of them are do vary. In terms of what a sort of heat map of pollution looks like, we have a very sort of classic diagram that you might have seen before. Because of the sort of hyperlocal nature of pollution and where it comes from, looking at a kind of pollution map of London for most pollutants kind of looks like a road map. So you can see that the darker areas, which is where pollution is highest, are along the major road arteries in the borough. That's for NO2, this is for PM10, and this is for PM2.5, which are finer, smaller particles, and you can see the same pattern is reflected there. So we monitor pollution as a council at a number of sites. We have a number of different types of monitoring, from automatic monitors, which are the kind of highest quality and the most expensive sort of bits of kit that we've got 6 of, right through to sort of medium cost sensors, such as Breathe London sensor network, of which we've got 60 at 60 of our primary schools. And all of this data is all freely available online and can be interrogated and downloaded by people. It's not always the easiest data sets to kind of navigate as a layperson, but all this data is open source, so people can always see what the numbers are showing us. And then just to kind of very briefly on the sort of trends, this is for Hammersmith Town Centre, which is our sort of longest standing monitoring station. You can see on the left the trends there for NO2 since 2016. So we've basically halved the concentrations of NO2 since 2016 at that site. And then on the right hand side is a similar graph for PM10, which again has gone down, but by a lesser amount. And then finally in this section, just to kind of reiterate, as I mentioned earlier, there are lots of synergies and co-benefits with our wider climate emergency work and our wider work towards net zero. Often air pollution and greenhouse gas emissions come from the same source, whether that's tailpipe emissions from vehicles, whether that's gas boilers. They're often one and the same, so action towards reducing one will almost always reduce the other. Climate change may also make air pollution worse, particularly around ground level ozone emissions, which are an increasing issue in London over the last few years. And then also air pollution can contribute to climate change in some ways as well. So a bit of after that sort of background and context, our work is really in this area is really framed by our air quality action plan. So that's a 5-year statutory document that was adopted by Cabinet and the Council at the beginning of this year. It kind of has a number of actions within it across the sort of the work of the council, but the main issues that we're looking at are really kind of systems change, so reducing the sources of pollution that we ourselves can control, and then kind of behavioural change, so raising awareness of pollution amongst our residents, businesses, schools, etc., all our stakeholders really, in terms of what they can do to reduce their emissions themselves, and also how to avoid exposing themselves to high levels of pollution. The action plan commits us to meeting World Health Organization guideline limits for air quality by 2030. So from a statutory perspective, we have to meet national government objective levels for air quality. The World Health Organization guideline limits are much more stringent. They're much more difficult to achieve. They're much more ambitious. And we're one of the only London boroughs that has committed to meeting the full WHO limits, there are interim limits, but we're going for the full ones by 2030, which aligns us obviously with our net zero goal. And then the final just element of this is probably that in terms of that raising awareness, there is a kind of a steer within the council that by raising awareness amongst our residents of both what they can do to reduce pollution, but also how they can reduce their exposure, by raising that baseline level of awareness, that will actually enable us to do more ourselves, because we'll sort of have more of a coalition of a willing. So that's kind of the principle of it. The action plan contains a range of actions by the council. There's 40 headline actions. Within that, there's about 70 or 80 total kind of sub-actions across a lot of areas of our work. Again, very similar to all the work we do on the climate emergency. There are very few teams across the council that aren't doing something that either directly or indirectly will help us reduce air pollution. And then within that, I won't speak to all of these, but really I've kind of touched on a lot of them actually in terms of kind of how we approach all of the actions and the action plan as a whole. You know, we want to be outcomes focused. We want to focus on air pollution as a public health issue, linking it to the wider climate emergency, and really empowering our communities so that they feel they can take action. They feel confident in taking action. They feel confident in pushing us for more action, perhaps. And yeah, and then, as I say, kind of tackling inequalities is an important angle for us as well. So in terms of how we're actually delivering the action plan, as I say, at the end, the sort of the third section of these slides kind of focuses on some of the specific actions we're taking, but a really powerful conduit for our kind of work on air quality is working partnership. So the Better Air, Better Health Partnership, which is a formal collaboration between ourselves, Imperial College London, and the Imperial College Healthcare NHS Trust, with Frank and Gareth here, respectively, from those two this evening, is a kind of a sort of triple helix type approach to bringing together, obviously, the council, world-class academics and world-class sort of healthcare clinicians to think about what kind of expertise, what data we can bring to the table to kind of drive innovation, drive behavior change, and yeah, work together to kind of improve the quality of the air that we all breathe. So I won't go through these, but in terms of the partnership objectives, you'll kind of see that they're coded very similarly to the way that you can view our air quality action plan, in that some of them are behavior change focused, and then some of them are the kind of systems change focused, which are more specific policies. So in terms of the sort of work streams and priorities that we have at the moment and moving forward, going to kind of speak to 4 areas of priority: building emissions, transport emissions, indoor air quality, and then the kind of behavior change, which sort of sits across all of them, and kind of talk through a little bit about what levers and opportunities we have, the challenges we have, and kind of what are the key deliverables for those. So starting with building emissions, as I say, they've remained stubbornly kind of static in terms of their levels over the years, and are now relatively probably the largest single source of emissions that we have in the borough. The levers we've got there are very policy focused. So with the forthcoming local plan that's in development at the moment, there's plenty of opportunities for us to look at how we manage new development in the borough, both through construction and demolition, but through in-use building, sort of in-use operations. Carbon co-benefits are extremely strong for this one, and there are strong existing council policies and strategies, so particularly around how we minimise dust emissions from construction, which is a real challenge, and one area where air quality maybe comes up against or butts up against some of the other priorities that we have at the council, in terms of obviously wanting to promote good development, promote growth, and those kind of things. Some challenges here particularly around the sort of slower timeframes of planning policy, and also the sort of challenge of influencing how buildings are used once they're actually sort of in use. In terms of transport emissions, key kind of major levers we've got are obviously around the urban realm. So there's parking policy, and we obviously introduced in February our emissions-based parking permits and parking policy. In terms of sort of infrastructure, we can facilitate active travel, and we have a really extensive electric vehicle charging network as well. There's our own fleets, of course, and then there are localized solutions to issues where air quality may or may not be the primary reason for doing it, but will have benefits. So the South Fulham cleaner neighbourhoods on one end of the sort of geographical scale of those, and school streets at the other. In terms of challenges for transport, I know that the transport strategy was the last item that this committee looked at. So that being in development is a real opportunity actually for us to have more of a strategic overview of everything. The levers and what we can do around transport are political and can be quite contentious. And also we don't have a direct control over a lot of transport. So when we think about the map I showed earlier of where pollution is highest in the borough, it's along roads that we don't control because they're part of the TfL strategic road network. So it's kind of a lobbying and public affairs piece for us. Just very briefly on School Streets Plus, because it's kind of a priority area, an area that Claire knows a lot about, who'll be speaking later from Mums for Lungs. School Streets Plus programme is really a programme that aims to deliver improvements to every school in the borough. That doesn't necessarily mean it will be a school street for every school in the borough, because they're not going to be appropriate everywhere, but it's about a whole holistic range of measures that we can look at, including school streets, which are obviously timed road closures at the beginning and the end of the school day, but also green screens, active travel parking, there's rain gardens, there's changes to school buildings in terms of mechanical ventilation and air purifiers and that kind of thing. But at the moment, we have 4 school streets trials ongoing, and we have tested the feasibility of having a school street at every single one of our primary schools. Indoor air quality is a very new area, both for us and generally in the world of air quality. We spend about 90% of our time indoors, and there are a whole range of pollutants, some of which are specific to indoor environments, but some of which are kind of the outdoor pollutants that come into our buildings. And so the action plan is probably the first time that we've really addressed indoor air quality. We have various powers to do with wood burning and permitted fuels. There's strong community co-creation and engagement around indoor air quality. So particularly something like the Well Home project, which is a fantastic community-led project that Imperial have done around indoor air quality in the White City area. And it also links very closely to our Healthy Homes work around fuel poverty and energy efficiency. And again, it links back in then to kind of the inequalities element of air pollution in terms of our work, particularly for those that are in fuel poverty at the moment. Challenges there. It is a very new area of work, so is the science necessarily all there? And there are challenges around influencing people's behaviours in their homes, or people feeling that they're being told what they can and can't do in their homes. So there's a communications angle that's really quite critical for indoor air quality. And then finally, behaviour change, which is obviously sort of covers all of these categories. How we can encourage people to be aware of pollution, to feel empowered to make decisions that do something about it, whether it's to reduce their own exposure to it when it's high, or to reduce their own contributions to pollution, is a challenge, particularly when at the moment, and we've done focus groups on this, people have many things that they're worried about or concerned about in their day-to-day life. Pollution sometimes does struggle to cut through in terms of messaging. The levers we've got here are really the really strong relationship we've got with the partners that I mentioned earlier in terms of the NHS Trust, having academics from Imperial involved, and really focusing on the sort of co-benefit of air quality, action and health. So yeah, challenges there. Council comms does have its limits in terms of who we talk to, and that's a challenge for us to kind of grapple with ourselves in terms of making sure we're talking to the right residents about things, and also getting the messaging right. So quite often, the council is not necessarily going to be the right messenger for this stuff. From the focus groups we've done, air quality messaging is going to be most trusted if it's basically delivered by a female GP with primary school age children who lives in the borough. So if we find them, then they can kind of deliver the message, and that's how we kind of cut through all the other issues that people are thinking about in their day-to-day life and try and get some of those kind of key messages across. And then my last slide is just very briefly to give the committee an update on outdoor waste burning, which doesn't quite fit that neatly within any of the previous 4 categories, just that it did go through Cabinet in May this year. And I think it's just really an example of it kind of contains some elements to it as a policy that hopefully reflect the wider policies that we do in terms of we want it to be evidence-based. It's got very strong links to the kind of climate emergency, climate adaptation and resilience. And it really will be a really strong behaviour change piece, because if we end up doing a bylaw of some sort to prevent people from burning outdoor waste, we're going to need a pretty strong behaviour piece with it to explain it, to kind of accompany it, so it doesn't feel like sort of dictating to people on that. So those are, I think that was the last of my slides. Yeah, those are the last of my slides. And yeah, obviously happy to take any questions.
Thanks for that presentation. That was really, really incisive and quite thorough. I'm going to take questions from the committee first. Councillor Lloyd Harris.
Just like to say, thank you very much for that presentation. As a newbie, I found it really helpful. Don't say I agree with everything, but I thought it was really well put together and constructive. So thank you for that and your team. What I'd like to know is you mentioned about bylaws. Now, bylaws are wonderful if people understand actually what they are, and also the ability to enforce them. Now, whilst the council may have some excellent bylaws, where we fall foul is that they're not enforced. So people sort of think, well, it might be there, but I'm not going to be caught unless you're that man that's got fined £1,000 for putting his rubbish out a bit early. But how do you envisage dealing with that? Because it's an important area. People will burn garden waste. You know, we don't want them to, clearly, in other waste. How are you going to address that?
Yeah, you're absolutely right. It is a challenge in both fronts. I think in terms of sort of before I get to enforcement, in terms of the sort of bylaws itself, the National Government White Paper on the devolution bill, should that progress, will make it more straightforward for councils to introduce new bylaws. In terms of the enforcement, we have teams in the council that will respond to complaints about smoke already. So we are a smoke control area in terms of which gives us some statutory powers. So there is kind of a team that when we get people that complain about general smoke as a statutory nuisance, they can investigate and enforce through it. So they'll be doing it. But I think really to kind of echo one of the points you made, it's going to be very important that we communicate exactly what it is to people, exactly what they can do, what they can't do. And actually, I think it will be a useful entry point for us to having conversations with our residents about wood burning more generally. So wood burning in people's homes, using wood burning stoves in homes is a massive source of particulate pollution as well. So while this policy is focused particularly on the burning of waste outside, you know, maybe some of the lessons we learn from how we communicate that to our residents will help us in terms of other policies around wood burning.
I've got two other short questions. Would it be appropriate to do those now or wait?
Go ahead.
Okay, then, thanks. When we're talking about monitoring, I think it's page 31, it says there's monitoring on the River Walk. Now, the River Walk takes up quite a large part of the borough. So can you tell me where are we talking about? Because quite a significant part of that is in my ward.
You're testing me on the exact locations of one of our monitoring. I will find out while I'll look it up, because we've got it all, and I'll let you know. I think
saying is it Hammersmith, because people use River Walk as a term that covers the whole of the River Walk, and aspects of it are not actually labelled as that. That was the only reason for that one. I will find out possibly while someone else is presenting and let you know. I will say, just in terms of monitoring with those sites, you know, we've got 6 of them across the borough. They're placed in kind of representative or strategic locations. Obviously, pollution shifts massively within meters. So the river, you know, we have a couple that are kind of known as background sites, which are in quieter areas. We obviously have ones like the Hammersmith Town Centre one, which is right on the gyratory. So we try and make sure they're just in a variety of spots so that they're kind of representative of wider data trends. But I will find out and let you know exactly where it is. Okay, thank you for that. And final question is about the emissions that come from developments. And we've got some very large developments in the borough. Now, is there any correlation between those and the fact that they are they are at the moment currently in areas where you would classify people as being, say, vulnerable or in need, or aged? Is anybody monitoring that? Because I know in my ward, in the southern part of the ward, there is so much development going on with the super sewer and everything else. And there's been a lot of work done on people having respiratory problems. It happened with Hammersmith embankment phase 2. And I can't imagine it's not happening up north where we've got quite a lot of development. So how does that impact?
So in terms of where development is happening, obviously across the borough, it will be happening very close to all kinds of different people with all, from different backgrounds, different socioeconomic backgrounds, close to schools, close to GP surgeries, all of those things. There are a lot of regulations and a lot of requirements for developers when it comes to both how they liaise with local communities when construction work is ongoing, but also in terms of how they manage their sites to reduce and minimize the amount of dust that's created, because construction does create dust. I mean, there's that so with the policies we have aim to kind of minimize and mitigate that as far as possible. And as I said, the local plan and the sort of planning policy that's sort of emerging over the next kind of 12 to 18 months here is a really good opportunity for us to make sure that the air quality policies in it are best in practice. But yeah, it's dependent site by site in terms of the conditions and how they liaise with more vulnerable residents.
And could I just request, sorry, this really is the final question on this one. Could I request that the council is prepared to actually enforce that, as against leaving it to vulnerable residents to keep contacting the council and saying, there's an issue with excessive dust, noise, whatever it might be, because unfortunately it creates a problem between the developer, who might think they're doing the right thing, and residents that are just, they're having struggling to breathe, which has happened on a number of sites. But if there's more enforcement or that obvious checking from the council, as against leaving developers to their own devices until something goes, hideously wrong.
Yeah, so I think it's probably a combination of proactive work by the council, and we do have to be reactive. So we do, in terms of our resourcing, we are reliant often on our communities telling us that there is an issue. When it comes to dust on construction sites, for larger developments, they'll have to have dust monitors on site. So they'll agree trigger levels with us. Should those levels be exceeded, either we'll find out in real time, or they'll have a duty to tell us almost in real time, and then we can deal with it. They'll have to take remedial action. We do have powers to stop construction sites or cease works if we don't think they're doing enough. So there is a sort of a data mechanism for it. But I think not just with dust, but with all other issues with the construction sites, we are always going to be reliant on residents telling us. We do have to be reactive in that sense, I think.
Thanks for that. I've got a couple of questions actually, and some of them are related. I mean, the mapping that you showed of the most pollutants were basically the hot areas were the roads. But we've had the conversation that construction causes a huge amount of emissions, and actually that's the problematic stuff that we're not managing to reduce very much. But still, that those heat maps were definitely showing the main roads. Now, is that because we're also building on those main roads? Because we're using those main roads maybe as that's where construction's happening? First question. Or is it particularly related to idling? Because, I mean, just because of the air today, I noticed an Uber driver idling on the side road, and the pollution coming because it was sitting still. So that's a kind of double question. So, but it's also about monitoring. So if we've got particularly 6 monitoring stations, but that sort of heat mapping is slightly different from the monitoring. So the other question is about, you're saying the data is open source, but it's difficult to read. So basically, what I'm aiming at is, can we make the data all easier to read?
Yes, I'll take the last one first, because you might need to remind me of the other two. But yeah, in terms of the data accessibility, it is all open source. It is all freely downloadable. It's not massively easy to understand. Sometimes, I think, for the layperson. One of the things we're looking to do in the partnership we've got with Imperial and with the NHS is to kind of look at creating a better one-stop shop for our residents in terms of all the different types of data that we have. Because different types of monitors, you'll have to go on different websites and download them in different formats. And like, you know, there is an issue in terms of, you know, we could directly comparing the results from one particular type of monitor with a different one might get me in trouble from the experts in terms of the kind of the comparability of data. So there's some things to think about there, but we are thinking quite actively about how the partnership can kind of present a better one-stop shop when it comes to data to make it easily understood for people, because at the moment I don't think it is. In terms of sort of road transport emissions, in terms of particulate emissions, that is partly because development does tend to happen along busier roads or around busy roads. But also, even as overall road pollution, emissions from road transport reduce, pollution is, as I said, is hyperlocal. When it comes out the back of a vehicle.
Yeah, sorry, can we turn the phone off? Thanks.
When pollution comes out the back of a tailpipe or from the vehicle, from tyre wear or brake wear, and that is where it is. So that's why you do get still the sort of the hotspots or the worst areas of pollution are going to be when you're walking along our busiest roads. And then finally, idling is an interesting one, because I think the concern about idling that a lot of people have is rightly comes from the fact that it's entirely pointless and it's an emission that just doesn't need to happen, full stop. In terms of the proportion of our kind of road transport emissions that come from idling, it's not a massive proportion of our emissions, but it's one that is, as I say, is entirely unnecessary, and we know excises people. And so when we think about idling and we think about action around idling, again, it's a little bit like the point around the outdoor waste, and actually we can use it as a pushing at the open door to start conversations with people about other sources of pollution. But in terms of idling as an actual source, it's not a major source of pollution for us.
Thanks for that. And following up on that, the behaviour change. I mean, we've seen in the last, for 50 years, a move against smog, fog, burning in general. People don't like people having bonfires on a sunny day when they want to hang their laundry out or whatnot. But behaviour, you're talking a lot about behaviour change. So I wonder if you can talk to that about how we are going to communicate to residents and try and nudge that behaviour change going forward without burning waste, but also with the other things, idling, a whole sort of understanding that air pollution is a huge health problem, and it's not just about mitigating climate change. We all like it's warmer because we want to get suntans, but sorry, I'm a bit flippant there, but the fact that we need to really hammer home that it's a big health concern.
Yeah. Well, I think that's the $1 million question for the work that I'm doing, is that behaviour change piece. And as you say, when things like the Clean Air Act and when London did clean up a lot of the smog that it had, I think we were helped by the fact that we could see it and that it was tangible. You could see the smog, and it's the same with bonfires now. So how we make the invisible visible, or however sort of you pithily want to put it, is a big challenge for us. And I think the focus has to be that different groups of residents will have different motivations, and thinking about, just a sort of a blanket message where we put up a load of billboards isn't going to quantifiably do something. We do need to understand people's motivations, whether we segment them into, school parents and different cohorts of people, or how we think about it is a real challenge. But it needs to be simple for people to understand, the impact, and then something actionable. You know, we need to find the calls to action which are simple that people get. So whether that is not idling your vehicle, whether it's signing up to get pollution alerts so that you can take action when you get a warning that it's high. It's going to be a sort of a suite of those kind of nudge behavior change things. We don't think there is a glitzy billboard that will kind of provide the answer for us. And so some of the work we've done again with the partners that are here is, we had a behavior change specialist that we commissioned last year that did some work and did some focus groups. We're going to do some more focus groups this summer to really try and sort of interrogate what influences people, what motivates them, and how we can also kind of piggyback in terms of other stuff as well. Because if people don't worry about air pollution, they should worry about their kids having asthma, or they should worry about through traffic, or, so it's what's the right message for the right approach. Does that make sense? Sorry. Yeah.
Great answers. Thank you for that. And unless we've got anything more, I think we can note the report and move on to our guests. Sorry, we've got a member of the public who would like to speak. Can we use the guest speaker? Do you want to come up and introduce yourself? It's actually, the mic is turned on, so you should be okay.
Thanks, Councillor. My name's Hamish Reid, and I'm from Hammersmith and Fulham Climate Action. I've got a few questions, actually, if that's all right. The first,
are you going to speak to the report that we've had, or because we've got 3 guest speakers, so you might want to break it up once you've heard them speak. But maybe we could hear.
I mean, they are related to what we've just been discussing, so I'm happy to share them
Okay.
now. But actually, there's one addressed to you firstly, which is about the layout of this Public Accountability Committee and how it could potentially be improved. Obviously, this is about us as the public, hopefully holding you all to account, but we're kind of relegated to outside the meeting, which is not a great experience, as you can imagine, sitting behind the presenters, especially for people such as Morag, who I'm sure won't mind sharing that she finds it hard to hear what's being presented. That's why she's taken action today and actually joined the table. It would be really easy to change this layout so that the presenters were on this side and we actually had a seat at the table and this speaker was at the front of that side. So what I'd ask really is just to think about how this is laid out. It's not a huge surprise that there's not a huge number of the public here actually this evening, because it's quite a poor experience, unfortunately. So I could just ask you to take that away.
I will take that as a note, and we'll take that as an action to have a look at how we can do it. We'll have to speak to the technical team, because we have actually had the conversation pretty much every meeting about how we could rearrange it. But unfortunately, we end up with a situation where some people can't see the screen, and then we've introduced the speaker chair so that there is a microphone available. We've asked for a wandering mic, which I'm afraid we haven't got at the moment, but we've got that on request. But I really appreciate you about bringing it and making it inclusive. So we'll have another look with the technical team and see
Even
how
if we just leave the technical team here and allow us to sit behind here and push you guys all that way, that could work without affecting these guys behind us.
Yeah, thank you.
Great.
Excludes what we used to do at the town hall.
I don't know. Sorry, right. So it's only because of the
Yeah, but it's straightforward. This isn't a great idea. You're absolutely right. It excludes people. But once we get back into the town hall building, where they may actually just have the meetings the way they used to, which is like this and straight down there, and there you would have people. So people, the councillors or whatever else be certain here, everybody had microphones and people that wanted to participate. It was not a problem. It was quite easy to do. But they haven't done that for years.
Oh, okay, so that speaks to the experience of years, unfortunately. But we'll try and make this setup work while we're here.
Let's do it.
Going forward.
Thank you. Great, and thank you very much for your presentation, Adam. It was really interesting. It was good to see the pollution had decreased, but it does seem to have flatlined for the last few years. And it was good that you mentioned that we should be confidently pushing for more action. And perhaps I might add more action and not more focus groups, because we probably had quite enough focus groups. What we really need to see is more action. One thing that we did notice was missing, and maybe Wesley, this is a question for you, given you direct this excellent climate team, is that there's no current transport strategy or no active travel strategy. That feels like a really big gap when we're talking about air pollution and action against that. So what I'd ask is, when will the council have a transport strategy and an active travel strategy ready so that we can really strategically address these rather than piecemeal action?
Hi, Hamish. Yeah, it's a good point. If you recall the last PAC we had here, we had a presentation about the net zero transport policy. That is still being worked on. I'm going to have to turn to my colleagues, John and Hinesh, about what the timeline for that is. But there is a draft policy, but it's nowhere near ready to be published at the moment, as far as I'm aware. But you're absolutely right. It's important. And it is something that also featured in the scorecards, quite frankly.
Yeah, hi, I can follow up. We're currently working on the transport strategy at the moment. There's not a set timeline yet for its publication. We have got a mayor's transport strategy, though, that's been in place for a number of years, and that's what the council work towards at the moment.
Okay, maybe we could get a set date target for completion of that strategy. The next question, thank you, Hinesh, related to the school streets. And yeah, I commend the excellent score that Hammersmith and Fulham got in the climate scorecard, and we're looking forward actually to hearing more from that team on Thursday. If any of you wanted to join that call, we've got a call with the climate scorecard team themselves about Hammersmith and Fulham. But we've only got 4 school streets in this borough, and as I'm sure you all know, that's a really, really low number. And it was obviously really disappointing to see the lack of ambition that we've only got 2 more in the works. I mean, most councils have like dozens of school streets. So what can we do to ramp up and speed up the rollout in the school streets? I live really close to the Wendell Park school street. Is fantastic. Like, it's transformed the neighborhood. Every morning is such a joy to see that street full of cargo bikes and scooters and people walking to school. It's had an impact on the whole neighborhood, and local residents have really taken a positive experience from that. There's so many other schools that would really benefit from this. What can we do to speed up that rollout? And actually, just to add on that, the clean air neighborhood as well. We've got 1 clean air neighborhood, no mention of plans for further clean air neighborhoods. What are we going to do to speed these things up, given how urgent this is?
I think we're going to take those separately, aren't we? Would somebody speak to the school streets? Because it's...
Yeah, I can speak to the
Okay.
school streets. Thanks for your question and your input as well. Yes, we do have a low number. We have assessed the feasibility for every single primary school in the borough, so all 60, between 60 and 70. Number escapes me now, sorry. It has been a challenge. I think the main issue that we've sort of come across is that actually a lot of the school streets that were implemented in London were implemented during COVID, and the Hammersmith and Fulham, we didn't introduce that many. And that has meant that when it comes to the kind of school demand for them as well, it's not been as strong as we necessarily thought. I think in terms of how we can increase uptake and rollout, I think what we need to be doing more of, and we will be doing more of, is going back to those communities that do have them. So you being close to Wendell Park, the other 3 that we currently have trials in, and going back to the community to kind of see the kind of changing in perceptions, because we've only ever done them alongside public consultations, and residents don't tend to be in favour of them. But we know that as they bed in and that people see the improvements that you've talked about, that opposition should reduce. So I think there's work for us to do in terms of using both the local communities that have them and the schools that have them as well to kind of promote them further. I think the other point that I've kind of made was that the school streets is not always going to be the best option for a particular school, and that's why, you know, we talk about the School Streets Plus programme. And there's going to be a lot of work, a lot of delivery. We've got funding to deliver a lot of those sort of plus measures. So not necessarily timed road closures, but whether it's green screens, whether it's mechanical ventilation for classrooms or air purifiers or cycling facilities and active travel infrastructure. There's a lot of other stuff that goes on around schools. So the aim is that, you know, councillors will be able to just name a school and we'll be able to say, well, that's what we've done at this school. I don't know if one of the other officers wants to talk to neighbourhood improvement schemes.
Claire, did you want to come in at that
And
point? I know
yes,
Claire's going
yeah.
to do her presentation, which will involve quite a lot around schools, but you might want to come in at that point.
Well, I think just basically a lot of what I'm going to be talking about is school streets. So it feels like this might be a discussion we want to do after that.
Yeah. Thank you. Thank you. And do we want to talk to neighbourhood improvements? I mean, I know there's lots of discussions about it, but
Hi, I'm John. I'm Director of Climate Change, Transport and Parking. We've got consultations out in areas for neighbourhood improvements. We don't necessarily badge everything as clean air, but the same techniques that we use for managing traffic issues go under any label. Really depends on what the particular issues are. But there's areas in the north of the borough that have currently been out to consultation where we've got some support for them to be developed for this year and around Olympia Brook Green, and we've had interest from around Barron's Court. So they're in discussions, but it's things the residents have got to want them and bring them forward. It's not something we're pushing at them.
Great. I think
does
there's
it answer?
one more question. I think
Yep.
just to respond to that one, I think, you know, as Adam said, if we just wait on our hands until residents ask for these things, which we know are effective and we know bed in well, that's kind of a bit of a weak approach. You know, we need to be a bit more confident and a bit stronger. This is a really urgent issue. It's affecting people's health. We know school streets work. Okay, why don't we have confidence and go to the schools and say, look, we've done an assessment. There's 60 schools. We've only got 4. So there's a good wodge of schools there for whom this would be appropriate medicine, and say, look, we think this would be actually a good for you.
I think one of the key pillars, though, that the administration has is doing things with residents and not to them.
Absolutely, do it with them.
Consultations are very important. If we just enforce,
Absolutely.
then we end up with the backlash and we don't get anything done.
Absolutely do it with them, but actively try and do that, you know, don't just wait for a request, you know, go out, educate, inform, have the consultation. That's what we did in Wendell Park. Let's try and do that more actively. Okay, the last question.
Appreciated. I think Councillor.
Sorry.
Yeah, I just wanted to actually agree with you, because I think the whole part is what I take from this is we're trying to get people to change their behaviours. So it's providing a body of evidence as to why we can offer something that is better than they may not have thought of. So doing things to people, all you're going to do is you're going to get people's backs up. You're going to pit neighbour against neighbour. It's providing information about why this is a better option, why staying the status quo is actually not possible going forward. Fine. But if you do not have people going along with you and supporting you, this will not work.
So maybe I misheard what was.
We need people to be on board and supportive and understanding of what is trying to be put forward, and then consult.
I think that's exactly what I'd agree with. You know, what I heard was that we're waiting for schools to request these, but as you said, Amanda, we actually have to reach out and inform people, engage them, take them on that journey, and that's our responsibility, the council, not to just wait for people to ask for these things.
That's true.
Okay,
But we also,
I think-
can I just on that whilst that's absolutely true, we have to also be aware that not everybody is going to want it. So whilst you would like everybody to, and there might be very good reasons why not, and something else is more effective, but having a consultation and not liking the outcome but still enforcing it is not ideal. So we've got to make sure people are on board, and that is actually what we're suggesting will work.
Yeah, and
That's not what I said.
And that I think people understand rather than
Yeah.
There's
a role for the council to help people understand before we
communication
reach
is there.
consultation. If we sit on our hands, or if we wait until everyone agrees on something, we would literally do nothing. But yeah.
I don't think that's the case. Councillor Harcourt.
Thank you. Yeah, this is a difficult one. My mind immediately goes back to the school in Banham Street when we introduced a school street there, we thought there's Banham Street. You can walk up the middle of Banham Street during the middle of the day. There's no traffic, there's nothing. It's such a quiet street. So we introduced that school street. There was then absolute chaos because parents still delivered their children, but instead of delivering them outside the school, they delivered them in the surrounding streets. The residents were then up in arms over that, and we had to take the number of fines and things that came out was unbelievable because of it. So we had to adopt a whole new approach. And this is part of the Schools Plus idea, that it's not just sealing off the school street either end of the street where the school is, but looking at the issues in the wider area and other issues that can be done associated with that, such as the greening that Adam was talking about, such as and all the other methods that go with it. That takes a little bit longer to do, but yes, I think I wouldn't disagree that we do need to increase the number of school streets, definitely.
I think,
Obviously, there's some.
excuse me, but I think because
So some way it won't work. For instance, there's St Stephen's on Uxbridge Road. You can't close off Uxbridge Road or the one on King Street. So you've got to look at which ones there are. And we've done the survey work on that. So it is a question of implementing them. And when it came to Wendell, the number of, I spoke to you about it, if you recall, ages ago. And there were a number of parents who wrote to me wanting the zebra crossing at Larden Road, the crossing outside the school, and so on. And it seemed obviously there was a major amount of support for that. So therefore that made it easier. But in other areas, that's not the case. So you do have to tread slightly more carefully at times. But yes, in principle, yes, we need to get more.
yes, and I think because we've got Claire here, I think we should call it on school streets for now as an issue, because I think we're going to speak to that in a minute. One more is relevant to this report.
It's a great question. So wood burning. Okay, so wood burning, Adam, you touched on, is a big issue. It's not really related to sort of socioeconomic issues. It's not the poor households who are burning wood. It's the wealthier, higher income households who are installing the wood burners, want that sort of house and country look. What are we doing with the powers that we've got? How many times have we taken action against this? Because it feels like we've got powers that we're not using, and it's an increasing issue because you can see these people around installing wood burners, getting deliveries of huge quantities of logs that are really affecting the air quality.
It is a good question.
Yeah.
Yeah. We do have powers, and anyone that uses a wood burning stove or appliance should be using smokeless fuels or using an exempt appliance. There's a massive DEFRA list of appliances that and types of fuels that you should be using. I completely take your point. Whether people are or not is tangibly they're obviously not in a lot of areas. In terms of what we're doing, so we're part of a couple of sort of borough-wide consortia. So there's a wood burning project that I think is about a dozen boroughs, including ourselves, which is led by Camden, which have done a lot of sort of social media campaigns and some sort of flyers, and that in terms of just raising people's awareness, because I think most people that buy them don't even know that they're not meant to be buying the ones they buy. I think and then the second element that we've just started exploring more particularly with Westminster and I think K&C as well, is around engaging with the suppliers themselves. And the problem is obviously when people buy online and it comes from elsewhere, but there are suppliers that we can talk to and remind them of their kind of duties on it. We do have duties or statutory powers around it. In terms of the number of enforcement actions we've taken on it, I'll have to get back to you, and I will get back to you.
Amazing. Thank you very much.
Thank you, Hamish. Right.
Sorry to interrupt, Chair. Can I just very briefly go back to Councillor Lloyd Harris's question about where the River Walk monitoring station is? It's on the top corner of Frank Banfield Park, so it's not in your area, but why it's named that when it's not actually is maybe a question for another time. But yes, it's one of our background sites, so it's aiming to look at kind of more ambient levels than being on a busy road. But anyway, there you go.
I've got a resident who'd like to ask a question. That's fine. Great. Introduce yourself, but could you turn the mic on? Because people at home can only hear if you
Sure.
speak to the microphone.
Can you hear me? Yes. So Gauthier Well, H&F Climate Action Group. Listening to what has been said, I think there's a bit of a contradiction between reaching WHO target by 2030 and having the maximum number of people on board. I'm not sure you can have both. So depending on what are your priorities, I think you might have to choose either you want to reach out to reach the WHO targets, or trying to have the maximum of number of people on board. But that's the sort of contradiction that I have in mind. My question is following up on the chair's point on behavior change. We know that it's difficult to make people change. What kinds of incentives, positive or negative, do you plan to introduce to encourage more sustainable behaviors from residents, commuters, visitors? You mentioned parking fees, so I understand that it's part of the transport strategy as well, which is a very strong lever. But could you just elaborate on how this is going to work in practice? Because we know that communication to drive behavior change is not gonna, it's not gonna work that much. So we want incentives, positive or negative. So what sort of incentives are you going to put in place? Thank you very much.
Thank you for the question. I think the main incentive is probably what we've talked around in terms of really strongly linking any action we want people to take with the tangible health benefits. We know that people don't necessarily completely understand the impacts that pollution is having on them and their families on a daily basis and a long-term basis. So when it comes to incentives, it's not a tangible, it's not a monetary incentive or disincentive in that sense, but the behavior change piece has to be a health message, essentially, in terms of the action you can take and the positive impact it will have on you, because then you can almost make it quite a self, people's motivations can be selfish. It will improve your health, it will improve your family's health, which might be a stronger motivation than some of the other things we talked about. And I think by linking the air quality message so strongly to health, that also enables us to get people to take more action on the wider kind of climate emergency piece sometimes, because carbon emissions can feel very non-tangible or a bit amorphous, they're a bit off in the distance, whereas knowing that a certain behavior or a certain thing you do or a certain thing happening in your neighborhood is immediately having an adverse impact on your health or your children's health or whoever it is a very strong kind of motivator.
Following up from that, is there some way that we can point the public to look at the air quality plan and see, because you said there's 40 headline actions and there's 7 key themes. Well, actually, rather than sitting listing them at committee, are they online where we can direct Gauthier to have a look and see all those little things that are happening?
Yeah, the council's air quality web pages has the action plan on it. I think it could be a little tidier, if I'm being brutally honest, the committee in terms of the web pages at the moment. I think it's gone the way of a lot of council web pages that we add when we have something good to add, we add it. So it's quite a long page if you scroll down through everything, but it is all online. And when I spoke earlier about the kind of creating the sort of one-stop shop for pollution data for our residents, it's one of the things we're thinking about with our partners is it a microsite? Is it something on the council's website? How can we package everything up? Because we are doing a whole range of actions over all kinds of different areas. How do we, and so are our partners, how do we kind of package it up so that people understand in a similar way that we've done with, say, healthy homes or a lot of the climate action that we do? What's the umbrella brand that people can recognize and understand and sort of know that their actions is kind of feeding into?
Thank you. Excellent, thank you. Good questions, and that gives us some stuff to work towards as well. Now moving on, but within the same subject, we've got some brilliant guest speakers. So Professor Frank Kelly is here from Imperial College London to speak about the things that we're doing in collaboration. So I think we're going to speak in turn, and yeah, over to you. Welcome. You can stay at your seat.
Okay.
Yeah.
Thank you. So it's been very interesting so far. And I did prepare a presentation, but I think I'm going to skip several of the slides. And just because I think we need more time for discussion, and I've got two other speakers coming after me. So the first thing I want to say is this is a really, really important public health issue. And it's a really, really important economic issue as well, both for the boroughs, for the city, for the country. And it's a human right issue. So it's, you know, people working in this committee, the staff and the council, you know, this is really, really important to get right. So well done for pushing forward with your action plans. We've talked about Breathe London. This is a sensor network which is community-based, the large part of it. And we have found that that has really got an underpinning of people's understanding and activity. When they understand the issue, which they do when they've got their own measurements, they really do get more active. So I think that's an important issue, and the council has got lots of involvement in the scheme, so that's great. I think the other thing, which maybe Adam, you didn't say, we expect people to go on websites, we expect people to go on smartphones to get the information. We are working with the council to get the information onto the street. So people see it when they're walking to their surgery or their hospital appointment or the library or their school. So it's just getting it in front of them and helping them understand it, making it a high priority issue. We've talked about roads, we've talked about construction. Pollution comes from anywhere where we burn anything, where we generate energy. So we've been working on areas that you don't think about, such as the subways, the railways, but we have talked about indoors tonight. So I'm going to talk more about indoors. And the big issue, as I've already said, the thing which will help people change behavior is understanding the health impacts. And that is why we have in London the best traffic policies. Basically, besides Paris, we're the only city which is really pushing forward, you know, controls of traffic emissions, the congestion charge, the low emission zone, the ultra low emission zone. And yes, that discussion we had earlier, you don't need to get everybody on board. We will never get everybody on board. You will have detractors. But when people start to see the benefit of these schemes, they will welcome the policies to do more. Gareth, you're going to talk about health a lot, so I'll skip that as well. There's our traffic policies, which were hard fought, hard won, but they've improved air quality in London more than anywhere else. And that's improving people's health. And that's really important to show. So some of the work that we've done, for example, here's a study which we did. You can see the title, Health Impact Assessment of Current and Past Air Quality on Asthma in London. There's data there from 2016 and data from 2019. And basically in 2019, the two right-hand graphs of London, you can see they're lighter, which means asthma, you know, exacerbations, hospital admissions has gone down because of those traffic emissions. So we're doing it to improve health, and we're getting the data through now, which is showing that it's improving health. So we're on a really strong wicket here. I want to talk about indoor air quality because this is something which we heard is new. We didn't really think about it before. We were too worried about, you know, what was coming out of tailpipes. But now we're beginning to understand, because we have the equipment that we can actually put into people's homes and not annoy them immensely through noise and energy use, etc. We're now beginning to understand the sources of pollution in both in homes and in workplaces. So again, this is really, really important because you heard we spend a lot of time indoors. We get exposed to a lot of pollution indoors. Here's some data that came out of, I think it was in Wandsworth, and it's just looking at PM 2.5 concentrations in a number of different locations. So starting there on the left, a quiet back street, 4 micrograms per meter cubed, below the World Health Guideline. Fantastic. That's what we need everywhere. In a normal home that understands the issue, also very small. But that home lights a candle, then suddenly it goes up to 250. Who knows, who understands that? People like lighting candles, they like burning incense, etc. And then when you start cooking, you can't see it because it's blocked out there. But as you start cooking, then the levels in the kitchen will go up. Waste fires we've talked about, they are incredibly polluting. We've done a lot of work now in workplaces. This is data from an indoor market where there's a lot of fast food going on, but everybody's there selling other things. You wouldn't think that everybody's being exposed to 4,000 micrograms per meter cubed of PM 2.5. And then if you use your extractor, which you should in your kitchen, if your kids are out playing in the garden, they're going to be getting exposed to that pollution from the cooking. So again, you just got to think about behaviors that work and behaviors that don't. So we have the data now, we're collecting it in lots of different places, but it's really complicated. And I think it's more complicated than what we were doing previously. So just there on the left, you can see that there's the particles, which we all know about. There's the gases, like NO2 and SO2 and ozone, but there's also the viruses, there's also bacteria. There's also VOCs, volatile organic compounds, such as formaldehyde and benzene, which are in the paint that we use in our walls and floor coverings, in our furniture, etc. And then lastly, but this is totally new to me 3 years ago, there's a lot of damp and mold, especially in social housing. I've even got some in my bathroom. It's really difficult to get rid of. But we've got to get out simple information like if you are showering in the morning, you've got to open that bathroom window to decrease the humidity and let the water vapor out. If you've got difficulty because where you live and you want to dry your clothes and you've got to do it indoors, you've got to open the window. Otherwise, you're going to end up with terrible damp and mold. So there's a lot of education here which will lead to improved behavioral change, which is I think very simple and will help everybody. We've heard about the Well Home study. This is a study of 100 homes in the White City area with a lot of the kids in those homes having asthma or a severe allergy. We have had wonderful cooperation with these homeowners or renters. And by the end of this year, we're going to have a very good understanding across a whole set of social classes about where the issues are, what the problems are, and how those are linked or not to various health issues. So Hammersmith and Fulham are going to be out there in the front of this type of understanding, because this hasn't been done anywhere else, certainly in the UK at this level. And then the final thing I want to say is, we're also now worried about microplastics. Now you hear about these issues, they're in the news headlines. We didn't know about these even 7 or 8 years ago because we didn't have the technology to be able to measure them, to see them, to measure them, and to understand that they were plastic and what their chemical composition was. So all those techniques, methodologies have been now undertaken, produced, and we're doing the measurements now, and we're beginning to ask questions like, are they in the blood? Do you breathe them in? Do they stay in your body? What's the worst source of them? How quickly do they degrade? Do they come out of your body? All those things. So this is an issue I'm sort of raising. It's not for tonight, but it is something that you're going to have to think about in the future, because we are a plastic world, and this is an issue that's not going to go away. And then finally, just to remind you, we have got the World Health Organization guidelines for pollutants. So here you can see the guideline sorry, for PM 2.5. This is an annual one. It's 5 micrograms per meter cubed. For the gas, nitrogen dioxide, it's 10 micrograms per meter cubed. In the UK, we have individual country guidelines which differ sometimes. In England, you can see it's 4 times higher for PM 2.5. Scotland, it's twice as high. The other two, it's 4 times higher. For NO2, it's 4 times higher everywhere. Now, when the problem we have is that often when you look at any government website, they are using the legal UK or country-based guide standards, not the WHO guidelines, which we know are based on the most recent health evidence published in 2021. So that is great that this borough is aiming for WHO guidelines by 2030. That's what you should be doing. And when you talk about pollution in any form or mitigation of it in any way, that's what you should be saying. That's what we've got to aim for, because it's going to improve health and it's going to improve your family's health. Thank you. That's what we should be doing. I'll let you read those. Thank you, Chair.
Thank you very much for that. Very good. Have we got any questions? Councillor Lloyd Harris.
It's on Adam's computer.
Yes. I'll send it around.
No further questions for the moment? Yeah, that was brilliant. Thank you for coming. I'm going to now hand over to Dr. Gareth Thompson.
Brilliant. Thank you, Chair. Yeah, so I'm Gareth Thompson. I'm representing Imperial College Healthcare NHS Trust. I'm the sustainability clinical lead, and big part of my role is looking at how we can deliver more environmentally friendly healthcare in our hospitals and also in partnership with our communities, which is why I'm here today and why I'm part of the collaboration with Imperial College and with Hammersmith and Fulham for better air, better health. I just want to commend the council for the work that's been done and the ambition being set. I think it's really important, and I think it's credit where credit's due for the work that's been done already. So I'm delighted to be able to talk a little bit about the health impacts of air pollution from the perspective of our hospitals and the local community. So as Adam and Frank have said, air pollution has negative health effects across all people, all organs, and all age groups. So it's not just lungs, brain and heart health are negatively impacted as well. We know that air pollution is a dementia risk. We know that air pollution contributes to cardiorespiratory disease, so cardiac disease as well. It affects literally everyone, and there is no safe level of air pollution. As Frank alluded to, the WHO guidelines limits have been revised over the years, and they're going quite markedly below what the previous WHO guideline limits were in the past. And that reflects that reality that really any air pollution is bad, right? There is no safe level. We also know that the economically deprived suffer a lot more. Lower socioeconomic groups are heavier users of acute healthcare services, which puts demand and economic pressure on our hospitals directly. We like to say that human health is the face of climate change and air pollution. And this has an immediate connection to the world of today. It's not the distant future. It's happening now. We're all very aware of that. Perfect example is the hot weather today. We know that ozone levels are higher during these spells of really hot weather. We also know that as these hot weather spells increase, what we're seeing is higher, more persistent levels of ozone. So before we used to have it for 1 or 2 days, now we can get it for up to 4 days, and it persists a lot longer. And this has direct negative health effects. So addressing the root causes of climate change and air pollution has health co-benefits through a multitude of connections. And of course, Improved air quality is one of the big ones. Almost everything we do to reduce climate change emissions also improves air quality. And this has a direct relevance for our healthcare services because tackling climate change and improving air quality today has immediate health benefits for people today, not just for the future and for future generations. And we have really good research evidence to back this up. Give just a couple of examples. We know that spikes in air pollution cause acute disease exacerbation. For example, we know that inhaler prescriptions go up in asthmatic children and adults on higher pollution days. It's been demonstrated that there's a very strong correlation there. And we know that acute asthma emergencies and even deaths are more likely on those days, which again increases the burden on health services and acute services and causes quite devastating impact for those unlucky families that are involved. We also know that air pollution contributes to the development of childhood asthma, both indoor and outdoor air pollution, which we're increasing our understanding of thanks to the latest research. So it's likely also a causative factor, not just affecting those who already have asthma. In particular, of course, vulnerable respiratory patients are particularly at risk, particularly sensitive to air pollution with a direct mortality risk. For example, those with COPD and asthma, in the adult populations. Those long-term health inequalities add a chronic burden to NHS services, whereas better population health results in healthier, more resilient communities. So there are very clear benefits to tackling air pollution and climate change in terms of health. As a side note, we know that economic growth that is not green growth using a combination of green tech, regulation and policy is likely to result in growing pollution and worsening air quality. Therefore, focusing only on macro level economic growth to lift people out of poverty may also ironically damage the health of those whose poverty has been alleviated. So unless we really drive air quality improvements through green growth, we're not going to get the full benefits. I'll skip through the next bit. So in terms of action, we're very clear that more needs to be done by us as well in the healthcare system to empower our clinicians and patients on air quality. So what we've done as a partner in the air quality collaboration is we brought the voice of paediatricians, public health doctors and emergency medicine clinicians to some of the air quality collaboration workshops to make sure that expert voice is heard, and also to give those clinicians an opportunity to listen to researchers, listen to the council, listen to local residents as well. This is really a co-creation effort. It's not just a top-down, we are the health experts approach. I think it's really important to collaborate and understand all the stakeholders' needs. One of the things we did as part of the collaboration is we installed some of the AWARE real-time air pollution displays in 3 of our hospitals and 5 GP practices, because we want to get that real-time feedback on how staff and patients interact with better air quality data and what that means and what we can achieve in terms of behaviour change from the healthcare system's point of view. So some of that early information is starting to come through, and it's quite illuminating because it's real feedback. We're looking as part of the collaboration to do more. One of the ideas that we're pitching based on a project at Great Ormond Street Hospital is to embed air pollution data into electronic patient records tied to postcodes, which will enable our clinicians to provide personalised advice to those patients and families most at risk of air pollution exposure. That targeted advice given at the right place at the right time is one of the ways that we can get over some of the difficulty of delivering the message of air pollution, because as we know, it's very tricky and nobody's really cracked how to deliver that messaging that really enables behaviour change to take place. So that may shine a light on that. And so this work on air quality is really vital, and our hospitals will continue to support the Better Air, Better Health collaboration. So to sum up, Our hospitals and community health services are committed to this collaboration and future air quality projects. And there's lots of opportunity there, including exploring novel funding sources together in the coming years and improving air quality to improve population health, enable people to live their best lives and avoid, reduce avoidable disease. So yeah, thank you very much.
Thank you
Any
very
questions?
much. That was really good. Again, it just occurs to me, I'm going to speak to say it out loud, the move on not smoking indoors over the last 20 years must have had a big impact on health, I would have thought. Has that started to come through? Are you seeing that in data, that that behavioural change actually affected really good change?
Yeah, absolutely. I don't have the figures at hand, but there's reduced exposure to passive smoking definitely has an effect, particularly in non-smokers.
And it also is that, again, the theory of behavioural change, that if you get enough people going over to the other side, that actually it gets to a tipping point where everybody just agrees, actually, because I think we've all gotten to the point where nobody wants smoking indoors anymore. You know, even the hardest core smokers have been convinced that it's one brilliant thing that's happened in society over the last 20 years. Anyway, that was a bit of a tangent. Any questions? Councillor Nimmo.
Well, thank you. Yeah, echo what Nicole says. Very informative presentation, Dr. Thompson. I wanted to ask about sort of in terms of health admissions, because given all we're doing in Hammersmith and Fulham, I just wanted to ask: is it at all lower compared to other boroughs and the types of diseases that are caused by air pollution, given what we're doing, or because sort of toxic air cares not for London borough boundaries, is it about the same? I'm sorry if that's a bit of a silly question. This is my first committee meeting, so thank you.
Yeah, Councillor, you're absolutely right. Air pollution doesn't apply to boundaries. So probably, I mean, I don't have the data to hand, but the health impacts are likely to be similar to most other regions of London. Frank can maybe talk to that in a bit more detail, but yeah, it's broadly comparable.
I can give a bit more information, although there's plenty of different ways of kind of sort of cutting the statistics on it. But one way of doing it is there's a statistical tool of sort of life years lost from or fraction of mortality attributable to various types of pollution, and it kind of goes back to my presentation and kind of the map of the borough. And if you think about a map of London where pollution is the worst in the very centre, and then as you tend to go out, it gets better. So we are, in terms of the sort of health impacts, in around the sort of 10th in terms of local authorities in England for the most adverse impacts. All the 9 above us are boroughs more central than us. So it kind of, the worst, while it is obviously it's transboundary and doesn't obey borough lines, generally pollution is on average worse in like the City of London, and then as you go out it tends to decrease.
And I found it fascinating, the relationship between the economics and now also go back to the well home studies that you're doing. I don't know if it's come out yet. Is overcrowding a big issue? Because we've got kind of two conflicting things. If we build homes, we create pollution, but actually we need to build homes for people to live in, because it's one of the big issues of the day. Is overcrowding one of the indoor pollution issues? For example, the hanging laundry, is that just, you know, when you've got 4 or 5 kids all in a small residence?
Not necessarily. It can vary tremendously, but that there are situations where you do have 5 kids and 2 bedrooms, and there's not a lot of outdoor space. But on the other hand, you know, you have the opposite as well. And there's still, it's the behavior of the household. What they cook, when they cook, you know. If you use a gas stove, you produce a lot more nitrogen dioxide and small particles than if you have the luxury of having an induction hob. And what we've found, the most, I think, depressing thing we have found to date maybe more, but at the moment, when the evening meal is cooked and the pollution goes up, as you saw from some of the figures in the kitchen, there's often not a door between the kitchen and the living area. So quite soon it's going out into that area where the kids may be doing homework or are playing on their smartphones or whatever. But then within the next hour, it's sort of progressed into the bedroom. And as it decreases in the kitchen and decreases in the living area and increases in the bedroom, what do we do at night with our kids? We close the bedroom door. So it actually stays high in the bedroom much longer than it does in the other areas. So the kids are being exposed to more pollution simply because of, we're trying to keep them safe and keeping the bedroom closed.
Well, these are really quite stark learnings, aren't they? Then they're not obvious. So, and quite frightening. Shall we move on? Thank you very much for that presentation. I think we'll all speak to it at the end. But Claire, I'm going to come over to you from Mums for Lungs. Thank you very much for coming. And
Hi, thank you very much for having me. I really appreciate it. And as Gareth said, thank you for well done with the work that you're doing. It's really good. I do have a presentation that I'm hoping might come up. But I am going to skip through big chunks of it because I'm aware that it is probably gone 8:30. Anyway, I'll introduce myself. So my name is Claire. I work with Mums for Lungs. We are a grassroots campaign network of parents who are united by our concern about the impact of air pollution on children's health. We are mums. It was set up by mums in 2017. Parents who were on maternity leave, walking around with their young babies, started to look into air pollution, found out that actually in Brixton, where they lived, the health limits were exceeded in January for the year. So they got very concerned. I got involved in sort of 2018. My kids are a bit older. And we worked together to raise awareness about air pollution. And that's about the impact it has on our health and children's health, and also what we can do to reduce our exposure to it, as well as reduce our contribution to it. And we campaign for schemes that essentially will reduce air pollution at source. If you wouldn't mind skipping through. So there are two main pollutants that we worry about. The first is nitrogen dioxide, which is a gas that comes from burning petrol or diesel. And the second is particulate matter, fine particulate matter. And this comes from tyres and from brakes. It's the fine dust from tyres and brakes, which is why electric cars also create air pollution. Particulate matter also comes from wood burning, which, as was mentioned earlier, is a huge source of particulate matter and actually has exceeded traffic in recent years. The trend for wood burning has had a huge effect on the quality of our air. If we could go to the next slide. So we've heard how terrible air pollution is for our health, and I'm just going to kind of drill down a little bit about children because that's what we focus on. So children are particularly affected by air pollution, and this is because they breathe more frequently and more deeply than grown-ups. So the actual volume of air that they are taking in for their body size is more than an adult. And what that means is that they are doing that at the same time that their lungs are trying to develop. And it's very hard for lungs to develop to the size that they need to for the size of the body when they are doing so in polluted air. So it stunts the size of children's lungs so that their lungs don't reach the size that they need to support their grown body. And the other thing about children is they're actually exposed to more air pollution than adults because they're shorter, so they are closer to the emissions. So not only do they take in more air, they are closer to the emissions, so they are exposed to it more. If we could go to the next. So we campaign on lots of different levels: individual, local, regional, and national. This is obviously a local meeting, so I'm going to focus on school streets. It's also what I sort of specialise in. So yeah, if you wouldn't mind going to the next thing. So school streets are when you close the road outside of school at pick up and drop off. In the morning, 25% of the rush hour traffic is going on the school run. It's a huge volume of traffic. We can see during holidays when suddenly the traffic disappears, that is the impact of the school run. But obviously people also go on holiday as well. But the school run is a really huge part of the traffic. And what happens if you close the road outside of school is that you're keeping some of that traffic back. And that helps reduce the amount of air pollution around the school. So when children are going to school in the morning on the school run, they are following the same line. So 75% of kids are walking and cycling to school every morning. They are following the same routes that the cars are taking to the school. The school is at the nexus of many, many journeys. And on that journey to school, those children are exposed to up to 5 times more air pollution than at any other time. So that school run is actually the most toxic part of their day. The cars that are on that main road next to the playground, that playground will remain as polluted as the main road until lunchtime. So first play will be done in a very toxic environment. And then obviously classrooms will also be exposed to that air pollution, and classrooms are very badly ventilated. So, so the thing about the school run is that it not only pollutes children on their journey to school, which is a journey that they are legally prescribed to do. They have to go to school. That is something that every child has to do. And then they have to spend the day in a school that is more polluted than other places. So by having a school street, what you do is you reduce the air pollution, you reduce the number of cars. So car use goes down by about 18% in a school with a school street. Air pollution goes down by about 23%. These are Transport for London figures, and I think they probably vary according to the school street, but these are the ones that they give. So if we put a school street in, we help reduce the air pollution, we help reduce the car use, we keep the air pollution away from the school, away from the playground, away from the classrooms. So it is a hugely impactful thing that we do. And it is more than the sum of its parts. It's incredibly targeted on the most vulnerable people in our society. If you wouldn't mind going to the next. And the thing is there are 800 of them in London. There are 800 school streets in London in the last 5 years. They are happening at pace everywhere. In Lambeth, which is where I live, our council will have 90% of all primary schools will have a school street by this November. So this is taking place everywhere around us. This is a picture of a school street celebration. So some parents got in touch with me and they had a school street, but they felt that it didn't work, that the cars were still coming, they were using barriers, not AMPR, and they were frustrated. They felt it wasn't working, it was dangerous. So we did a celebration of the school street. We kind of put more attention onto it so that parents could see that it's actually a really important thing. It's really welcomed by many parents. I did an assembly about air pollution. We gave out flyers. And it was a really, really positive experience. We invited the council along. They came along, made contact with the parents. Now the school street has AMPR. It is much better enforced. It is much safer. It's much less polluted. And in some other research that we've done, what we can see is that if you introduce AMPR as enforcement, it will pay for itself within a year. A school street will pay for itself within a year. If you don't use AMPR, it won't pay for itself, and it will probably be less impactful. So the school streets have been around for about 5 years now, and I think the definite move is to have AMPR, because that enables more ambitious school streets if they're not working, if parents are putting out barriers or not putting out barriers. It could be quite problematic. It can be quite confrontational, which isn't anyone's dream start to the day. Government advice from Department for Transport and from Active Travel England both say we shouldn't be using barriers. We should be using AMPR. So there is a massive move to AMPR. Sorry, automatic number plate recognition. So cameras. And if we go on to the next slide. Yes, I've finished. Thank you.
Thank you for that. That's, I think we sort of spoke to school streets earlier, but I think we need to look back. We can have a look at a couple of things you've said about the toxic playgrounds. I mean, it does make me think that, I mean, one of the things we've put in down at the river is a kind of smiley face and an unhappy face just for when bikes are speeding. And it feels like we should have these smiley faces in our playgrounds that can turn into a miserable face if the air gets too toxic. And I see what you're saying about confrontation as well, because unfortunately, again, it's about behavioural change. How do we stop the minority, absolutely the minority of people who arrive at the school with their child and they will even park right in front of the school where the zigzags quite obviously say you're not allowed to park because their child is their very important person in their life. So it's it's the behavioural change, how we convince those minority that their child being in the car is actually toxic for all children.
In terms of behaviour change, it feels like school streets are very good places to practice this, because people understand that children's health is really important. Children's safety, road safety is very important. And so you already have an understanding of that. And so if you start to say, right, we need to restrict car use around this school, there is an understanding of that. So in Lambeth, where I am, there are lots of people who are very angry about lots of, traffic reduction things, but they are not angry about the school streets. I feel like the school streets is something that people understand the public health message of it. And then what you have is you have a change in behaviour, and the majority of parents don't drive anyway. 75% of kids are walking and cycling in London. But the majority of parents are appreciative of the fact that their children can get to school more safely, it's more relaxed, it's easier. And so that does change a culture as well. And it doesn't have to be too prescriptive. It can actually be quite a joyous part of the day.
Thank you.
Sure, surely it's quite similar to your example of indoor smoking. To begin with, there will always be some objectors, but whenever people see the benefit and people find that they're on the wrong side of the procedure, then everybody slowly changes and doesn't do it.
Thank you. Thank you. Do we have any questions? Yes, Councillor Nimmo.
Thank you very much for the presentation. This is absolutely fascinating. I was just wanted to ask, sort of, in terms of in all your work and your experience, sort of, you provide us, I guess, guidance for how us as councillors can do our jobs more effectively. But how do you tend to balance the interests, say, of parents of schools who might be broadly in favour of school streets versus like residents who nearby who might, again, be angry about, more restrictions in their area? How do you go about managing that sort of tension there?
So in terms of a school street is normally very good for residents, because residents can drive in, they can drive out, they're completely unchallenged. It makes no difference to their experience, but they don't have the horrendous situation outside their school with terrible parking, dangerous driving, reversing, idling. So that goes, and they can come and go as they please. So on the whole, residents are generally, in my experience, you very rarely hear of angry residents. It's generally, that's not the case. I think Hammersmith and Fulham has a very high level of non-catchment schools. So faith schools and private schools, it's about 54%, which is so private schools in London is 12% generally. It's so 54%. It includes faith schools as well, but that's an incredibly high percentage. So a non-catchment school will normally have a much longer catchment to come to the school, so they'll have higher driving rates. So it might be that if schools aren't taking it on board, it's because they're aware that their children are coming from further afield and they're not potentially, you know, as receptive as they would be if it was a school with a smaller catchment.
That's very interesting, actually. That maybe that is one of the things we need to take on board when we're looking at their sort of neighbourhood improvements and the schools within those neighbourhoods. Councillor Harcourt.
That's very, very, excuse me. Well, that's very interesting. I just recall the school where I was the chair of governors, catchment area was about 150 metres, 200 metres at times, because they were so oversubscribed. So it depends on the type of school. To make that sort of blanket assumption isn't right. But yes, there are schools where that we all know about where people are coming from across London because there's particular
Yeah,
need.
I mean, on the whole, faith schools.
Both primary schools tend to be different. It tends to be more the secondary where there's greater.
Primary school will have higher driving rates, and for non-catchment schools, they will probably live over a mile away, which will be a 65% driving rate. So secondary schools, children can travel independently, so they're usually less problematic.
Do we have any questions?
Just
Yeah, Councillor.
a comment. When you were talking about the private schools and the faith schools, what a lot of them do is actually provide bus service. So they will pick up the students from various areas in the borough, or you make your way there, or your child does. So they're taking, so in a way, it's actually reducing the number of journeys that need to be taken. And let's be honest, they're going to be small children. They're not, no 13-year-old is going to want their mother to drop them anywhere, I can assure you. Doesn't happen. But, you know, primary school, yes. So they are, in fact, doing their bit. And these vehicles are usually EV or changeover.
Yeah, and that can definitely be the case. Yeah. Where we are, the secondary schools are very good at having coaches, and they have a lot of those. The primary schools don't. They are less. They have less services. It might be that the schools here, the primary schools, do have a lot of coaches, and then that's what you want. That's great.
Thank you. Yes, Hamish.
Hi, everyone. I'm back. So I think we could all agree that getting air quality information to the public would be really beneficial, just because there's really low awareness and it's kind of an easy win. And Professor Kelly, I think you mentioned that in your presentation, that's something that you're working towards with your sensors. It'd be great to hear the plans for that, but also the opportunities for the council, you know, to use digital advertising hoarding, to send emails to schools when there's high levels of pollution, things like this. I loved your idea about the playground smiley face. I mean, one thing that Gautier and I reflected on, unfortunately, that would just be a constant sad face in the playground, which is a shame. But I mean, maybe just go with the UK's rubbish targets rather than the WHO ones, and it looks more happy. But anyway, so that was our throw out. How do we get to this stage of raising people's awareness of how bad the air quality is?
I think to a certain extent we are. So when it comes to pollution alerts to schools, you send them out, and Imperial were part of the commissioned by the GLA to sort of do that, and we're also, I know Imperial are doing work on adjusting or trying to adjust the index measure, because as Frank alluded to, in London too often it's green. It comes across as fine too often because we're using our sort of the trigger points are not set in the right place. So there's work to be done on that. We have been talking, and it's a bit of a watch this space, so I can't give you any tangible action, but the Councillor Trey's idea around the smiley face, sad face is something that we have been thinking about, because we do have Breathe London sensors at 60 of our primary schools. So if we can sort of map real-time data into real-time messaging at a specific school level, can't give you any tangible, we've done X, Y, Z, but it's something that we're thinking about doing. But I think it just shows that there's just a whole, it's this sort of the package of as I talked about a bit in terms of some kind of umbrella branding or how we present things, because it's a lot of sort of smaller or a lot of different sort of disparate projects that we need to kind of bring together so that people understand that they're all part of the same thing, rather than getting like a text message from AirText, which is a pollution alert service that you get sent from someone, from a company, and then you get an email that you might get from the GLA about your primary school tomorrow having high levels, and then the council, there's council messaging going out. Like there's a lot of messaging from a lot of different places, so we need to make sure that it's cohesive, which I don't think it always is at the moment.
If I could add to that as well, through the work we've done with the collaboration, it's become very clear to us that this is a very innovative space. No one has really cracked air quality messages and how to get those messages to people in an effective way. So it's gonna be about running experiments to see what works and what doesn't work. That's how we're gonna figure it out. And it's the same around the world.
Yeah, I think, yeah, if we could do it more in the public domain so it was more obvious. I mean, I have 3 kids at primary school, and if you are contacting the school, they've never once passed that message on. I got an email today about the summer clubs that the council are putting on. So they are passing some messages through from the council, but if there are any about air pollution, they've never reached the parents.
I mean, that is often a failure of these messages. We're relying on, if we're relying on others to pass the message along, sometimes things do get lost. And it's one of the we've had with schools generally is that, you know, obviously teachers are incredibly time poor, and it's about making it as easy as we can for them while being meaningful. So yeah, I'm sure there are occasions when schools will get, or the school business administrator or whoever will get the alert email saying pollution is going to be high tomorrow, and they'd pass it on to parents.
Maybe they're not even aware that they're supposed to pass it on to parents. Maybe that could be clearer in the message, because they do seem to pass on other messages.
What's left? Go ahead.
That's an interesting concept that the school passes on a message. Can I ask, you've got 3 children, you've just said, what do you do when the school rings you and said, well, pollution levels are going to be higher than what, who knows? What are you supposed to do as a parent? Are you supposed to go and get your children from school, which creates additional pollution? Are you meant to panic? Are you meant to be calm and think, I know what to do, my children know what to do? I think with some parents, you could terrify them because they won't know what to do, and what level are you supposed to say, oh my gosh, I better go and pick my child up? Because you're going to get some parents thinking, I don't know how this really works. So how this works is going to have to be very, very simple and basic so that everybody understands. Otherwise, you're going to cause problems. I don't mean you, obviously, specifically.
Yeah, I mean, it's a good question. I mean, there's 2 things really, Amanda. The first one is that you're doing it to raise awareness, because people don't know that air quality is an issue in London. And if they did, they'd be more amenable to some of the interventions that we're talking about and that we're so worried about implementing, because we don't think people will like them. The second thing is you can give really clear guidance as to what to do. Obviously, we don't want anyone rushing out to pick them up from school, because they're going to be breathing the same air at home anyway. So it would be much more about, think about avoiding using your car if you can, to contributing to the bad air quality, and also avoid strenuous exercise. Unfortunately, that's like not really particularly healthy when the air quality is very bad, but you can make that really simple, clear messaging in the message. The second question was about returning to our old friends, school streets, and Claire, we loved your presentation, obviously. I mean, I'm sure you guys saw the stats on that last slide. There's 800 school streets in London. That means Hammersmith and Fulham have got 0.5% of the school streets in this city, 0.5% for the borough. There's only 32 boroughs or whatever it is, but that is so woeful. I mean, if we manage to get our extra 2 school streets, that's almost going to take us to 1% of all the school streets in London, while Lambeth have 90% as their target. Like, that just is mind-blowing how far away we are from competing with our peers. Even if we look over the boundary to Kensington and Chelsea, our neighbours.
Who would like to speak to that?
It's a point well made.
So let's do it, guys. I think, I love the idea of doing things with residents and not for residents, and it sounds great, but it doesn't really allow us to show leadership, and to take this issue by the horns and be brave. And that's where we of course, we're not going to force things down people's throats, but we need to also guide. It took bravery to implement the indoor smoking ban. There was a lot of opposition to it at the time, but it's proved to be the same. And the school streets that we've rolled out properly have proved to be well received.
Thank you. Councillor?
Starting to sound very argumentative, so apologies, everybody. When you sort of said we had such a woeful percentage, could that also have something to do with the fact that, I think it was Councillor Harcourt said that some of our schools, it wouldn't be appropriate to have those. There's no major need for it. I could be paraphrasing, sorry, maybe it wasn't you. But also the other thing is we have a very, very condensed borough. So I can understand larger boroughs, there's more space, there's more availability to actually have these, so there's a real benefit. Here, I think we've probably got more constraints than other boroughs. So is that something that would impact on these or not?
I mean, I could answer that if you want.
Thank you.
So there's a thing called the Healthy Streets Scorecard that comes out every July, and it's coming out in a few days. So Hammersmith and Fulham are second to the last with school streets. So they're, apart from Bexley, which doesn't have any, every borough has got considerably more. And I don't think that Hammersmith and Fulham is that different to other boroughs. So I feel like it is something that is achievable. Lambeth, I don't know if Lambeth is different, like how different structurally Lambeth is to Hammersmith and Fulham. They're both inner London boroughs, but they will have done 90% by November. So I think it's true, you can't really do main road schools. It's quite difficult. You can do schools with bus routes on it, but main roads is a difficult one to do. So I would say that probably in Lambeth there are 10% on main roads, but the rest are doable and are being done. So I think, I think it's not as different to other boroughs to kind of explain the figures.
Okay, thanks for that. But I think, to be honest, Hammersmith and Fulham is one of the smallest boroughs in London. It is also one of the most highly congested, high density. So that will have an impact. And also, whatever our message is going to be to residents, then it has to take that sort of into account about what people's options are. Just sort of saying we're doing it because everybody else does it is not a good enough reason. So as long as we get the right marketing, that sounds doable. But we do have a small borough and it is congested.
But those are reasons why we should do it, actually, Amanda. And we set up a group which was parents for school streets in Hammersmith and Fulham, and our assessment was there are at least a third of schools which are really suitable on quiet back streets, and which we're not pushing for. I mean, the ambition of it getting 2 more is just not even scratching the surface of the need for it in the borough. We know it's needed because we're here talking about terrible air quality. Okay, but thank you.
Thank you, Hamish. Well, thank you very much. I think it's been an excellent evening of a deep dive into air quality in Hammersmith and Fulham and the many, many things and actually the many successes. Thank you very much for bringing school streets to the fore here. I think Hammersmith and Fulham are doing many, many things, but there's been a couple of things that are really clear. Behavioural change is one of the big things that we need to work on, and those different ways of messaging, whether we, look at different kinds of screens where some social housing electronic screens maybe could carry some messaging, schools getting the message about air quality over to their parents in the way that maybe hay fever days are quite regularly announced now. So I think that's come through as well. I think we can have a look at as we look at neighbourhood improvements, how we help the school run. I think the school run is a biggie. I think would like to invite Professor Frank Kelly back in the future to talk about the well home and the indoor things that you start to find out, particularly on the microplastics as well. I know that Hammersmith and Fulham are doing a lot on damp and mould, so that came through, and I think we took that on board. But I'd like to thank all the presenters tonight. Everyone's been really insightful, and I think we appreciate it. Now, the next meeting, we know all the presentations, and we give you thanks. The next meeting is September the 24th. Now, we had to move it. We pulled it forward from November because there was a huge gap, but also for councillors to be able to make it. And then at that, we talked about covering the public realm work contracts, clean energy transition. So that's quite huge, again, a big story there. Heat networks we're going to bring, and generally energy efficiency. So thank you everyone for attending tonight, and I hope to see you